All right, this is Mark with San Diego Miramar College, and today we'll be talking about bandaging techniques. We're going to go over some general principles, the indications, the difference between dressings and bandages, and then show you guys some pictures of what they look like. So let's start by describing the difference between a dressing and a bandage. So we're going to take a look at these right here. Dressings cover up an open wound to aid in the control of bleeding and to prevent further damage or contamination. They should also be sterile. That's very important. It's coming in contact with that open surface of the skin. So we have, these are non-sterile gauze right here, but these are sterile. If you're applying direct pressure to a bleed, you should use sterile gauze. This is an emergency bandage. This is for controlling large hemorrhage. It's kind of a dressing and a bandage in one. This portion right here is the dressing. This right here is the bandage. And all a bandage is a device or a roll of something that secures a dressing in place. Now here we have a halo chest seal. That's for sucking chest wounds. This is another version of a chest seal. It's called a hyphen chest seal. Of the two, I think from my personal experience, I've seen a lot more of the hyphen chest seals, but I have seen some of the halo chest seals around here. So whatever agency you work with, obviously you're going to be using their equipment. And over here you have just a standard trauma dressing, sometimes called an abdominal pad, depending on the size. But these are all sterile. Trauma dressing, sterile, hyphen, sterile, the halo sterile, emergency bandages, sterile, and then you got your sterile gauze pads. Now we have bandages down here. So these are some examples of bandages. And again, a bandage secures a dressing in place. And in most cases, it doesn't actually have to be sterile. It's not that important that the bandage is sterile. It's very important that the dressing is sterile. So here we have a self-adhering bandage. These are very popular on the ambulances. You'll find all of these on the ambulance, but I'd say we go through the most of the self-adhering just because it's so nice. The gauze rolls, obviously, we got tons of those. Elastic ACE bandages, they're really good for pressure dressings when you need to get a lot of pressure. These elastic bandages allow you to really crank down. And then we have triangle bandages. You can use these for a number of things. You can make improvised tourniquets out of them. You can make slings out of them. You can make swaths out of them. You can use them to bandage somebody's head. You know, the uses are only limited to your creativity. And that's the cool thing about bandaging. You know, there's no hard, fast rules about what needs to be done. As long as you're doing everything appropriately, a lot of the dressings and bandages, the way you're going to arrange them is really left up to your style and preference. So just some general principles that you need to be aware of. Dressing materials should be as clean as possible. That means free of dirt and contaminants. So make sure when you take it out of that sterile package, you don't put it into the dirt next to the patient. Make sure you actually maintain the integrity of that dressing. Do not bandage a dressing in place until the bleeding has stopped. So as you're applying the dressing, you're simultaneously evaluating, is this controlling the bleeding effectively? Okay. We've got another video on bleeding control, and that goes through the algorithm. I'm not going to explain that here, but there's a bleeding control algorithm that you need to be familiar with. A dressing should adequately cover the wound. That's obviously important. If possible, remove all jewelry from body part area. Sometimes people get their hands mangled and they have wedding rings stuck in there, and you actually have to go in and cut the ring off, especially if you're far away from a facility. So that's important. Keep in mind swelling, especially in the wrist, bracelets, things like that. You want to be very cautious of. Get those off as fast as possible. Do not bandage a wound too loosely. That's pretty self-explanatory. You don't want it to fall off. Bandage wounds snugly, but not too tightly. Also pretty self-explanatory. If you are bandaging a smaller wound on an extremity, cover the area or cover a larger area with the bandage. So you don't want to have a very small surface area that you're bandaging because it's going to make it too tight. So you expand the area and it reduces that amount of pressure. So always place the body part to be bandaged in the position in which it is to remain. Another term you'll hear is position of comfort. You want to bandage in the position of comfort. Sometimes you can't bandage it in the position of comfort, but whatever position it's going to remain in, make sure that's the way you are bandaging it, so you don't have to excessively manipulate it. So what are the indications for bandaging? As an EMS provider, it is necessary to know how to bandage patients in a variety of ways for a variety of injuries. It's very true. You will see all kinds of mechanisms. You will see all kinds of presentations with all kinds of patient populations. So you got to be ready. Bandages and dressings will generally be used on the following: abrasions, lacerations, amputations. Make sure if you have somebody that has an amputation, you actually take the amputated part with you, preferably on some sort of, you keep it in a bag and you put it on ice, you wrap it up. Punctures, crush injuries, bites, not so much bug bites, think dog bites, burns, gunshot wounds, eviscerations, open neck wounds, splints, and impaled objects. So those are all situations where you will most likely be using bandages and dressings in some fashion or another. Depending on the severity, though, of the patient, other things take precedence, and on acute status trauma calls, you don't really get to bandaging all the little abrasions they have. So sometimes the focus, depending on the acuity of the call, the focus will shift. So let's just take a look here. I found these. I actually think these are pretty neat, from the early 1900s, some old bandaging techniques. But this stuff doesn't really change. Okay, so what you see here is basically what we do now. So this one's pretty neat. This is a head wrap. So he's got 2 rolls of gauze he's using. One roll is securing the roll that's going over the top of his head in place. That's actually a really neat technique. This is really good for securing, let's say they have a bleed on the top of their head and you want to apply direct pressure, but you don't want to occupy yourself with that roll for the rest of the call. You can throw a little bit of roller gauze around here and then go around the back of the head to secure it and actually keep the gauze on the top of their head in place. It also works for injuries in the occipital region and underneath the chin, obviously. This is a little dated, I must say, but the principle is the same, especially if you have somebody with a burned hand. This is something that would actually be beneficial. Now, I'm not sure about this little micro gauze they have going on here, but just say you got some regular 2x2 roller gauze. The same principles apply. You wrap each finger individually and you go down, securing at the wrist, wrap the next one, go down, secure at the wrist, wrap the next one. This is that improvised tourniquet I was talking about. It's called Cravat. You can use a wooden dowel, plastic, metal, something sturdy here. Tie a couple knots, throw it in, and just twist the dowel. And on the other side here, you see a little bit of gauze. They're actually creating a tourniquet. And something I want you guys to recognize, both in this picture, these other pictures over here, they're wrapping distal to proximal. So they're going from further away to closer on the patient. This is a good one. This is a wrist. And to be honest, when you get to the hospital, oftentimes they take off the dressing, the bandage that you put on. So it doesn't need to necessarily be the most beautiful put together bandage that you've ever seen in your life, because chances are they're going to take it off when you arrive. So this is what this looks like when it's completed. I like that. That's clean. And that's a clever use of 2 rolls of gauze, which you have plenty of in supply. So that's either a leg or arm, I can't really tell, but they use that cross-hatching rolling technique. That's actually pretty nice, but you don't see it a whole lot. This is a really good demonstration of how you would secure a cut or a potentially amputated finger wrapping around. Notice how it's secured to the wrist. If you were to just wrap this up here and tie it off, it's just going to fall. So you secure it down here to the wrist. That's a good visual for you guys. And this one, obviously, we wouldn't do this really out in the field unless it was severely burned, or if they had really, really, really bad road rash. And even then, depending on the transport time, you're probably not going to get around to doing this. But this is still good to see. Again, the really thin gauze is kind of out of style these days. You don't see that around a whole lot. But this one's a really good example. There's a dressing underneath. You can see maybe this was on some kind of a burn patient, but there's a little dressing underneath, and then the bandage is holding the dressing in place. So that gives you guys some sort of an idea, and should give you some reference as to what are we trying to do when we're talking about bandaging. Difference between dressings and bandages. So if you guys have any questions, shoot me a message on Canvas, or you guys can leave a comment down here. And as always, you have a great day, and hopefully we'll see you in the lab soon, all right?